Good morning, everyone, and happy Friday. My name is Tara Roth. I'm the president of the Goldhirsh Foundation, and I'm really excited to welcome you to today's forum on COVID-19 and the digital divide. COVID-19 has brought enormous challenges to our region, and specifically to the social impact sector. Community organizations, service providers, and public agencies are responding to some of the greatest needs we've experienced in decades, and doing much of it online. There is no business as usual. Even simple programs and services now seem to require immense technical support and virtual agility. We know that many of you joining us are working tirelessly to ensure that the most vulnerable in our region have access to essential resources and services during this time, from legal assistance and educational programming to food, healthcare, and housing. However, we also understand that there are innumerable challenges to doing all of that online and from a distance. Today's event was organized in response to feedback from our grantees, many of you. Our goal is to provide a much needed forum for those of you on the front lines to discuss the challenges and opportunities of virtual programming and service delivery, as well as to learn about emerging solutions to the digital divide. And all of that being said, those of us joining today's webinar are still among the fortunate who have access to reliable internet and a device through which we can tune in. We're now 7 months into LA's safer at home order, and those in our region without that same access to continue to fall farther behind. It is our hope that today's conversation will be a resource to you all as we continue in our fight to bridge the digital divide during COVID-19. Thank you all so much for being here and so much for the work you do. We are truly honored by your presence. And now I'm going to pass it off to LeAnn Kelch, the Social Innovation Coordinator at the Goldhirsh Foundation, to get our conversation started. Thank you.
Thank you so much, Tara, and thank you to everyone joining us for spending some of your Friday on Zoom with us. A few housekeeping items. At any time, if you have a question for our panelists, you can use the Q&A function available via Zoom at the bottom of your screen. We will collect your questions and save them for the end, so please stick around. Before bringing our panel on screen, I'd like to begin with a brief presentation about the scope of the digital divide, and also a discussion of some of the problems that you all are facing as submitted through your registration form. We know that the digital divide cuts across both socioeconomic and racial lines. 92% of Americans with an annual income of more than $75,000 have home broadband, compared to just 56% of those with incomes under $30,000. And 79% of US adults have home broadband, compared to just 66% of Black adults and 61% of Hispanic adults. At the local level, we know that low-income communities of color face the most barriers to accessing internet. And for that reason, our unconnected households are largely clustered in South and East Los Angeles, in communities like Watts, Boyle Heights, and Compton. 1 in 3 LAUSD students live in a household that does not have high-speed internet access or a computer on hand. When you registered, we asked you to share about the challenges that you are facing at your organization. They fell into 3 major categories. The first being internal challenges. We heard that some of you are feeling disconnected and isolated from your coworkers and staff, that there's a lack of training and support and even necessary professional development to adapt to this new way of doing things. Also, learning new platforms like Zoom is complicated. On top of that, there's technology fatigue. We're overwhelmed by screen time, and we know that it can be a lot for our brains and even our eyes to handle. There are also technology challenges. The upgrades necessary to deliver programs and services virtually can be expensive. And even if the money is available, it can be difficult to secure those devices, not only for our own teams, but especially for the populations that we serve. And there's inequitable access. Even if we provide something digitally, there's a clear distinction in who will be able to log on and who won't. There are technical glitches and quality problems. Even with a live stream like today, we never know if someone's Wi-Fi will cut out or if there will be a delay. And there's limited digital literacy among a lot of the populations we serve, including but not limited to older adults, young children, low-income families, and others. Finally, there are programmatic challenges. Many of you shared that you've seen drops in engagement and participation in your programs. whether it's less patients showing up to healthcare visits or students that haven't logged on to your after-school program in months. It's also hard to maintain the efficacy and quality of our programs through virtual platforms, and it can be hard to conduct outreach. If everything that we're providing is online, how do we communicate with people to let them know to log on? Some folks who registered shared that it's difficult to guarantee access to non-English speakers and to individuals with disabilities through platforms like Zoom, which is something we wrestled with even today. On top of that, we know that it's difficult to capture the time and attention of the communities that you'd like to interact with. So to address these challenges, we are so excited to be joined by this panel of experts today. First, we have Allie Bussjaeger. As Director of Impact and Sustainability, Allie leads Human IT's programs, development, and sustainability teams, and also champions the organization's internal and external environmental initiatives. She has 10 years of experience in the nonprofit sector with an emphasis on community, collaboration, inclusion, and long-term impact. Next, we have Dr. Guisela Juarez, a Salvadorian physician with more than 8 years of experience in healthcare administration. Dr. Juarez has participated in several medical brigades working with underserved communities, and in 2018, she joined Clínica Romero to support the health of LA's Latino population. She currently serves as the clinic's operation director. We're also joined by Allison Holmes, Senior Director of Operations and Strategy at the Annenberg Foundation, where she oversees operations as well as a number of initiatives, including Annenberg Tech and Annenberg Learner. Prior to the Annenberg Foundation, Allison served as the Associate Dean of Marketing and Communications at UCLA, Anderson School of Management. We'll also hear today from Amy Iorio, Chief Executive Officer of 9 Dots, a nonprofit organization teaching 6,500 children in local Title I schools coding and computer science. Amy has deep experience in digital product development in the media space. Prior to transitioning to the nonprofit sector, she was an executive at Microsoft and vice president at Yahoo. Finally, we're glad to be joined by Cynthia Strathmann, Executive Director at SAGE, a nonprofit that builds community leadership and power for economic justice by fighting for tenants' rights, healthy housing, and equitable development. Strathmann came to SAGE from the Los Angeles Alliance for a New Economy, where she now sits on the board of directors. So now, please join me in welcoming our panelists on screen and give us a moment while everyone turns their videos on. We're so excited to have you, and we know that this is a really important conversation. A lot of our attendees, as I mentioned, have struggled in this time to figure out how to do the same impactful work they were pre-COVID in this era. So without further ado, we'll get to our prepared questions. And as a reminder to our audience, if you have any questions to ask of our panelists, please submit them through the Q&A function available at the bottom of your screen. We're collecting your questions, and we will address them at the end of our webinar. Great. So our first question for all of our panelists: how has your work been impacted by COVID-19 and especially by the shift to virtual programming and service delivery? Cynthia, we'll start with you.
Well, thanks. It's had a big impact on my organization. We do a lot of in-person work because we do not only outreach and education, but also a lot of community organizing. And a lot of that organizing is very relationship-based. And relationships, you know, even in the modern era, have really depended on that home visit, that handshake, that, that meeting at SAGE where people can get together and really share their experiences. So it's been very, very difficult for the organizers. It's also been very difficult for the outreach folks who relied a lot on door knocking and canvassing. I mean, a lot of SAGE's work was trying to get out there in the community, let people know what their rights were. And we haven't really been able to do that. And we also have had to close the building to public access, which means that, we can't have the same kind of community meetings there that we used to have. And we used to have people coming in, just from the general public to drop in and ask questions about their rights as tenants or what their legal options were. So we haven't been able to do that. So it's had a really big impact in that regard. And well, we've, I guess we'll talk about some of the workarounds, but it's certainly been, difficult.
Thanks for sharing.
I could jump in. So at first I was going to say, well, 9 Dots has been impacted on every front, like everybody's. But when I step back, I realize it isn't really every front, because we're still teaching the same curriculum. We're still using the same platform. We're still working with teachers to teach in the same classrooms. But as everybody has had to change, we pivoted in March and created videos of our content, videos that the teachers, basically our teachers teaching, so that we could have asynchronous programming for teachers to assign to their students, because the schools weren't yet doing, live virtual Zooming. We spent the summer creating videos, more videos, so that if kids missed lessons in school, which is happening now, they could rewatch them. We created hint systems around all of our coding challenges, because previously in class, a child could raise their hand, talk to their peers, have a teacher wander around to explain, like, we'll try this and what about that. So now we have hints that the children can click on to move along. Our academy program, which was on site, we did virtually over the spring and had really good success. Actually, we had a bunch of middle schoolers pass the AP computer science principles test, but decided not to have them virtually this year, in part because of the fatigue you mentioned. They're online all day long, hopefully, and having an after-school program which compounded that didn't seem to make a lot of sense. But it, and our professional development, we had as much professional development, we had as much attendance as we did last year, but this year we moved into talking about Zoom and how to use Zoom and how to use Zoom easily. And so we sort of stepped back up a level to try to help teachers with problems that aren't really computer science coding related, but they are related to teaching well in this remote setting.
I'd love to jump in on that as well. I mean, as we saw from your opening remarks, LeAnn, digital inclusion has just gotten this giant floodlight, a spotlight, because of COVID, which has some silver linings, absolutely. But I think it's just brought to light how deep this issue was and how divisive it's been for folks for so many years who are feeling, the impacts of being on the wrong side. And at Human IT, our work is to bridge that divide. We help folks get access to the actual technology they need. So getting computers, helping them get internet connectivity, be that a hotspot, or getting signed up to a low-cost internet plan through a provider, technical support. What good is a laptop if you can't figure out, how to get it working? So tech support has become so key, especially in digital literacy training, giving people the basic skills they need to fully interact with that technology. I take for granted how quickly I can send an email or, do little things like that. But really that's a skill that a lot of folks are needing to learn. So, in 2019, Human IT, just to give it some scope, we were able to distribute 7,500 devices and support about 13,500 households in getting access to low-cost internet. We were really proud of that year. It was a great year. And thus far in 2020, we've been able to distribute over 20,000 devices and support over 31,000 households with low-cost internet. So that demand is just skyrocketing. School districts, healthcare centers, senior groups, just across the board, there's that demand. So we've been really pivoting quickly to try to address that as much as we can. And one of the favorite things for our employees to do, pre-COVID, was distribute devices in person and actually have events where folks could come and get their laptop and their computer and look at it and ask questions. And, our employees could have that interaction to give people that in-person support. Of course, that's not an option right now. So we're shipping devices directly to folks' homes and just making sure that comes with really clear guidelines and support to help them hopefully, navigate opening that box and having that new user experience. But it's been a huge pivot for all of us in so many ways. And I'd say the demand just continues to rise.
Hi, everybody. I'm Allison Holmes from the Annenberg Foundation. And I just want to, first of all, thank the Goldhirsh Foundation for putting this together, and really shout out to Tara Roth because of the work that she has done with the Goldhirsh Foundation in Los Angeles and 2050, and the impact, the sort of real-time impact and focus that you all have had is really felt, and I think has moved the needle in our city. So I just want to give you my utmost respect and thank you for putting this together. And the amount of interest in the webinar, if you will, just shows me how much we're all just sort of floundering right now and still trying to figure it out 8-9 months into this. As a parent of 3 kids who are in the other room in school, I feel it on so many levels, even from my place of privilege. But what's interesting with your question about, how has your organization changed? So I oversee the division of the Annenberg Foundation that is the education, which is called Annenberg Learner. And what in our instance, what is old has become new again in a way that's actually really disconcerting. So when we talk about the digital divide, we usually talk about access and devices, and those two things are absolutely the most important two aspects. The piece of the divide that Learner has focused on for over 40 years is the content piece. So once you do have access and a device, what kind of content are the students consuming? And Walter Annenberg, who is the founder of the Annenberg Foundation, many, many years ago had this vision, which seemed so revolutionary at the time, of trying to figure out how to get high quality content to everybody. So sort of even the playing field in the quality content arena. So he thought, okay, so what if we put high quality content on public television? Again, 40 years ago. And this idea that then everybody could have access to quality. He created these amazing series with the best teachers in the world, and through WGBH in Boston, and again, 40 years ago. So the content, if you look at it now, is ridiculously old and dated. But when COVID hit, and Learner was sort of starting, Annenberg Learner was parts of it are actually becoming obsolete because things have changed in 40 years. That was prior to the internet. Thank you very much. And suddenly we're getting all of these calls, a 40-year-old idea. We're getting calls from public stations, public television stations all over the country, asking if they could license the Annenberg Learner content, which is old, for the students during this COVID crisis. So we obviously licensed as much as we could for free to public television stations all over the country, anybody who asked. And I know that was a possible, and all kinds of school districts were looking at public TV, and still are, as a distribution platform, to level the playing field and provide equal access. There are all kinds of problems with that, but I just wanted to say how sadly interesting it is that the way that we've changed is actually going back to the origin of when we were formed.
Hi, I'm Guisela Juarez from Clínica Romero. So I will say that in our organization, especially because it's healthcare, it really impacted the way that we now deliver healthcare services. And we had to think about how we were going to continue operating our clinic, providing our visits and delivering healthcare to our patients with the pandemic, right? And at some point, we were struggling because during the first week of the stay-at-home order, our patient access and productivity actually dropped in 75%. So at that moment, we were really struggling and trying to think outside the box and saying, okay, what are we going to do now? So the clinic was able to successfully transition into telemedicine. As you know, now it's very popular, the way that we virtually can provide healthcare services to our patients. However, this is a process that usually will take between 4 to 6 weeks, and we kind of tried to expedite it and did it in 1 week and a half to try to keep up with the changes and that took a lot of effort from all our staff because we had to review our current workflows, implement it in our electronic medical record, and then pilot it, and then train the staff, and then socialize it with the patients, and start kind of shifting the line of thinking on this new way of delivering healthcare services through telemedicine. So I guess that was like the biggest impact in our organization, because we were coming from in-person visits to now to do telemedicine. And I think that in addition, it was very beneficial at the end, because for our staff and especially providers that had like pre-existing conditions or were at some higher risk to COVID, it allowed them to work remotely, to work from home, and they can still continue providing the services to the patient in a safer manner.
Thank you all for sharing on that first question. I know that all of you have experienced this in really different ways, but it sounds like the challenges are numerous. So I look forward to talking more about some of the solutions. I know you all started to share some of them, but there's been some really creative strategies. So our next question is, how have you seen the digital divide impact the communities you serve? And how is your organization working to bridge that gap? Dr. Juarez, I'd love to go to you to tell us more about what Clínica Romero has done with its telemedicine.
Sure. So definitely there is an evident gap in the communities that we serve, especially because now that we're able to bring telemedicine to our patients, we realize that not all the patients have the devices like a smartphone, so in which they can receive like a text message from the clinic for a reminder of their appointments, or to log into our patient clinic portal to actually establish like a virtual visit with the provider. So at some point we were now struggling in this other second piece, because especially the patient population that are at higher risk, that cannot come to the clinic because of the risk of exposure, are the ones that were struggling the most into accessing to devices or Wi-Fi itself. So the way that we were bridging that gap is with our nationwide and recognized promotora model. So these promotoras, that's a word in Spanish for the community healthcare workers, they are now working in the communities, providing these devices for some qualifying patients and individuals, and also hotspots, so they can get access to healthcare in that way. But not only that, but also to walk them through the steps on how to log in, how to navigate the web, how to log into the clinic's platform for the patients, and review their own medical records, and establish the visit with the provider. So I guess that's a very powerful model that the clinic has, because these healthcare workers are very recognized in the community as leaders. So people are very confident on coming to them and ask them questions, and they have all the patients, and then they deliver those instructions and educational workshops in a very cultural and sensitive way.
That's wonderful. Anyone else have anything to add? What have you done to bridge the digital divide in your work?
I'll jump in. And I'll also have the opportunity to thank LA2050 as well, the LA2050 grant, because what we found in the digital divide, LAUSD and Compton did an excellent job of getting devices out to kids. But if you think about households that have multiple kids, multiple parents, a device doesn't allow kids to be connected all day long, one child, and have their parents' attention to help them troubleshoot. So one of the things that the grant allowed us to do was to take every single one of our lessons, every grade, the whole year, and create videos, entertaining videos that would, of our teaching assistants giving the lessons so that kids could go back and visit it. And I wish I could show these videos because our teachers are working in their bedrooms or their whatever, and they built themselves costumes that looked like the characters that already exist in our curriculum, and they have these ridiculous costumes, and they're putting sound effects in. So the videos are super entertaining. Definitely something you'd want to go back and watch, and LA at Goldhirsh gave us the opportunity to do that. Additionally, we worked with the Chuck Lorre Family Foundation. They were going to give technology grants to schools to use in classroom, but pivoted during the pandemic to try to get schools more, repair and or replace broken Chromebooks, etc. So that's another element. One of the pieces that we haven't figured out the cross yet, we're finding that for our older kids, JavaScript, which is a written coding language as opposed to a block coding language, is harder for ELL students and harder over a digital system instead of being in a classroom where a teacher could encourage another bilingual student to jump in and work with them, or one of our teachers could kind of sit with them paired and walk through things in a way that you just can't do in a videos conference system. So we haven't really figured out the solution to that, but we're working on it. So like all of you, you find a problem, you work to find the solution, you find the next one. I think that's going to be what the year is about.
Does anyone else want to weigh in?
Sure. I think you hit the nail on the head, Amy, with your last comment of it's just a constant game of pivoting, reassess, get new information and pivot. And we're all doing that as quickly as we can, both, I know the panelists are nodding with me, and I'm sure all the listeners are feeling that as well. So, I think a lot of what we've seen too is there were some assumptions made about the digital divide, that certain households were connected. And Amy, you spoke to, maybe a home did have a laptop, and that's fantastic, but they have 4 students who are expected to be in class at the same time. And that's truly impossible, right? Or we're seeing all these heart-wrenching stories of students sitting outside of fast food restaurants on their phones to get connected to the internet and, quickly check a course, requirement or what have you. And yes, the phone is, connection, and that's a wonderful tool, but I personally couldn't imagine writing an essay on a phone, right? It just wouldn't be possible. So it's just brought to light, the different nuances of the digital divide. And it really isn't so simple. And I wish it was, but here's a device, you have internet, great, check you off the list. Technology is always evolving. It's ever changing, and we're trying to play catch up. And as we're playing catch up, that divide just gets wider. So I think, what we're noticing right now and hearing from the populations we're all able to serve and work with is there's so many more nuances than we ever thought before. And I think, for human IT, tech support, to be honest, used to be something that we rolled in as a service with our devices, which I think is great, right? You get a laptop, need some tech support, give us a call. That whole arm of our organization has boomed in the last 6 months because there are folks who, just need that more than anything is the tech support. There's students that might live with, older grandparents who just can't help them when their Zoom freezes or something goes wrong and, they're trying to participate in class. So I think just that need for understanding technology and keeping up with its evolution is more apparent than ever.
Yeah, and I could add in, we've had some success in bridging the digital divide. Sage works mostly with extremely low income people in South Los Angeles, from around the city, but predominantly in South LA. And a lot of them are monolingual Spanish speaking immigrants who work in the garment industry, although a lot of older African American folks too. And so we knew that their digital access wasn't great going into this. They're very reliant on phones. A lot of people don't have laptops just because financially it's easy to get your hands on a smartphone these days. It's a lot harder to get your hands on a laptop, and then you need to, have connectivity out of that. So when we pivoted over to doing online access, we really had to be cognizant of what are the platforms that they're actually already using, because those are the ones they're actually going to go to. And so we moved to Facebook Live events over a lot of other kinds of events. We're trying to get some of our core membership into Zoom meetings too, but there's a learning curve there. So when the first one we did, a bunch of our members went over to each other's houses so they could all Zoom together, which is very, heartwarming, but also kind of defeats the purpose of Zooming if you're trying to keep people separated. So, you know, trying to get people on board with what this is about has been a learning curve. We've also had to really hire interpreters where we used to just do the interpretation ourselves, but it's so hard to coordinate interpretation over Zoom meetings that it's really helpful to have a professional interpreter helping with that. Like that will just make everything go a lot smoothly. And we found it's really kind of worth the financial investment in that. And then the Facebook Live was a really, really good way to reach people because it's very, very easy to get into and access over a phone. And so we've reached a lot of folks through that. And for us, it was really, we know that a lot of people in our membership and in our community struggle with these digital issues. You know, they don't have like quiet places at home to work. They don't have, you know, good internet access. But in addition to that, all of a sudden, for us, because we do housing and there was this, you know, threat of these, you know, potential huge wave of evictions and everybody was looking to see what their tenant rights were, it became even more important that we use digital resources right around the time that, you know, they became much more difficult for people to access. And so we were doing things like creating, and you know, thanks to the foundation for helping out with this, because this is what they helped fund, were these template letters that would help people submit an automatic letter to their landlord saying, hey, I'm protected by this, 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 and this legal protection, which we've got vetted by various attorneys, that they could very easily work with through an interface. And then of course, and I don't do this work, I'm just saying I don't do this, I just have been like watching other people do it, that has been designed so that it will be very easy to access over digital devices for people who don't have a lot of sophistication in terms of trying to navigate their way around websites. So those are some of the ways. I think I was supposed to be talking about solutions, and really I just like named a bunch of other challenges also. But those were the challenges, and then those were some of the solutions that we also have been trying to come up with. Because of course, you know, the digital divide, in some ways it's like a methods problem in the middle of a whole bunch of other problems that we have about like schooling and healthcare and housing and all of these other like major traumas that have been, I won't say induced by the pandemic, but certainly exacerbated and revealed by it.
I just want to add, emphasize an emphasis on what you said, Cynthia. I think that the onus on school districts and on teachers, and when Amy, when you talk about these teachers, you know, using their resources and dressing up and using sound effects, it's, you know, anyway, we've all known, oh, it's just really just horrible that teachers have to pay for their own materials. You know, that used to be the narrative, and now that has deepened so much. A few things from the content perspective that Learner has done. You know, we spent a lot of time and resources making our content mobile friendly so that it can be accessed on a phone prior to COVID, but just a little bit prior. And we have added STEM materials, and the biggest local project that we undertook, you know, right over the summer was a partnership with with LAUSD and Discovery Education, because they came to us. So this is sort of public-private and philanthropy working together, and they said, you know, we can't go into this school year without a content solution. And one of the problems, you know, just like you said, every solution is sort of a bunch of, you know, creates a whole bunch of new problems. But you know, when you're talking about teachers who are accustomed to handing out pieces of paper in order to teach their class, which is the vast majority of teachers, you know, what are you supposed to do as a teacher? And you know, when you can't hand out a piece of paper, so there are so many resources that are being thrown at teachers, and I feel they are so burdened actually by these solutions that we all want to offer. So I even have mixed feelings about this partnership itself, but LAUSD really does need a platform that everybody can access for free. And Learner, again, has not ridden the digital wave. So we thought, from a content and professional development standpoint, we wanted to make sure that teachers had something that they could turn to in the event that they had pieces of paper and they needed one-stop shopping for not only professional development, but also course material, exciting course material and timely course material. So we have provided that to LAUSD for the next 2 years. And it'll also have learner content on it. We are now faced with the challenge of how do we make sure everybody knows that this is available to them, and that it's not just one extra tool in the toolbox, but in fact, it's something that's being used and being used uniformly, and people, if teachers want to, and that they know about it. So that's one of those are some of the things that we've done.
Thank you all for sharing. I know that a lot of our attendees are struggling with similar ideas, and as things improve and as we come up with solutions that I think initially month 1, month 2 of the pandemic were some kind of stop gaps of how do we take what we were doing and put it online. But the longer that we're in this situation, the longer we're staying safer at home, the more we realize that the pandemic itself is causing its own problems, right? So I know all of you are dealing with that in different ways and have seen increased need for some of your services, attendance rates, healthcare, device delivery, teacher resources, support for students at home. It kind of is compounding. And I think in this moment, when we don't know when we're going to emerge from this kind of era of being on Zoom, being digital, a lot of people are starting to ask those more critical questions about, okay, what's sustainable here? Where do we invest? Cynthia, you mentioned you found it was a great idea to invest in professional translation. So I think people are just asking some of those questions. So I appreciate hearing all of your responses, and I know our audience does too. And a quick reminder to those of you joining us today, that you can use the Q&A function on your screen to ask questions, and we are saving those all and we will get to them at the end. So I saw a raised hand at one point. So I saw you, and I would love for you to submit your question in through the Q&A so that we can be sure to get to it. Great. So our next question, we've talked about this a little, but I'd love for you all to expand. What gaps in digital access and equity still remain? And what solutions should we be pursuing? So kind of, we talked about what we have done, but kind of what are the next steps on this kind of, as we look out at expanding potentially this period of time into 2021? Amy, could you start us off?
Sure. I mean, it's such an interesting and great group of people, because to us, the critical thing is that there have to be partnerships between the foundations and people like Human IT. Like, the funding should be going into groups like that is getting technology to people and getting people trained. There has to be more effort into making sure there's good Wi-Fi, regardless of your zip code, working with providers to get students or teachers, hotspots or MiFis, better Wi-Fi. And I think this kind of cross, pollination here, digital literacy, which a couple of you have mentioned. I think once you get the technology and you get the Wi-Fi, you're right that it's not so simple for lots of people to know how to log on and how to get into video conferencing. And, digital literacy probably needs to be part of kids' elementary education because of how profound it is in citizenship and job qualification. And so, I think all of those pieces have to really come together to help provide the solutions as we go through this year and forward.
Would anyone else like to weigh in?
I mean, what I have to say is I think pretty broad, in that, SAGE has always taken this position that housing is a human right. It shouldn't be entirely market-based, and that it really should also be considered kind of an infrastructure product in the same way that we think about roads and water and power, and that we have like big public investments in schooling, for instance. And I think what the pandemic has really revealed is how important it is to have large-scale public investment and support for some of these systems that really need to be systemically supported. And I think thinking about information as an infrastructure is going to be one of those. And we were already, I think, at kind of a historical inflection point where we were really looking at what is it like to have information delivered to us in a completely different way? What does that mean politically for us? What does that mean for the future of living in a civil democracy? And I think the pandemic has kind of called the question on that in a really big way. And I hope that in some ways, you never know how it's going to play out, but I really hope that by revealing how important it is to have digital access, that we think about this as something that we just have to make an investment on in the future. I mean, arguably, everybody should have had devices before this. You know, all students should have had, you know, and I mean, I know there was a debacle with that at LA2050, et cetera, but, you know, putting that aside, you know, I'm hoping that what this will do is like really draw our attention to this, that we need to have a massive investment in infrastructure around tech and around information access in the same way that we have an investment in water and roads.
I completely agree.
And then I can go on, but I will like stop talking.
Oh, I think we're all right there with you. No, such beautiful points. And I think what that looks like more tangibly as well, just a few examples that come to mind is, you know, beyond making it accessible, what does it look like to sustain that long term? You can give a third grader a laptop with internet, and I'm thrilled that we're able to help do that, and that a lot of you are benefiting from that and seeing the, you know, the impacts of it. But what happens in 3 months when that laptop breaks? What happens when they go to 4th grade? What happens when the hotspot's prepaid 3 months for the semester give out and the hotspot, you know, isn't renewed? What then? And I think those are the kind of long-term solutions that, you know, I'd love to continue dialoguing about with collaborators in the space and foundations and organizations that are working really closely with students, with folks that are needing healthcare. You know, what does that look like after we've addressed the wound, so to speak, right? COVID exposed this big wound. We're doing a great job of triaging it. What does it look like after the triage to create a sustainable long-term solution, even when hopefully students and folks get to be in person again? Can't wait for that day, but I think we're still acknowledging that there's going to be a need for technology, even beyond that, to be successful and to be connected and to stay involved in the community in every sense that people need to be informed and healthy and, you know, participating in democracy truly, right? So what does that look like sustainably and long term? And there's still a lot more work to do there.
I would like to chime in. I think that, I mean, from the scope of work that I do, that we do at the clinic in healthcare, you see how new technologies are allowing people to control better their chronic conditions, to get a hold of a provider, vendors, etc., so manage their own care. However, even if you provide the devices, the hotspots, the Wi-Fi, what you were mentioning before, I think that also you have to let them know and develop some programs so they can know how to operate those devices and that technology, how to navigate those platforms that are going to help them to have a better quality of life. So in addition to have children being exposed to new technology, to new technological platforms and new digital information, we also have to develop programs for adults, especially for the ones that are elderly, not necessarily young adults, but because sometimes it's a little bit easier for a young adult to keep up with technology or for some to adapt to the new evolution in the devices and technology, etc. But what about our elderly population, for example? We see that with our elderly patients, and but when you take the time to sit with them and explain them how to use it, you know, it takes a little while, but then they can get a hold of it, and then they can learn it. So I guess investing in educational programs for children, adults, but also for our elderly population.
Would anyone else like to weigh in? Okay, we'll move to our next question. So what are some opportunities that you've all experienced as a result of the shift to digital during COVID-19? Now, we've definitely discussed the challenges and we don't want to minimize those, but we also know that through this, there might have been some areas of expansion or silver linings that you'd like to continue even as we return to in-person programming. So Allison, could you share about what Annenberg has been up to?
Well, thank you. I don't know, you know, when it comes to I don't know if I would call it a silver lining, but certainly opportunity is all over the place. on account of COVID-19 and the crisis, you hear a lot of people say how we've moved forward, 30 years in 3 months or whatever, but I don't think that, 5 years, not 30 years. So it is asking us to innovate more quickly, which is good. But I think on a more macro level, I think it's asking us to go back, if you will, to when Walter Annenberg was sitting thinking, what's wrong with this picture here? I think it's asking us to go back and say, what happened here? How did we end up building this system where schools and education, and when you talk to the superintendent of LAUSD, you can't think about the number of social issues that a school system is trying to solve and address beyond educating our kids. And then think about what teachers are being asked to do, and on the front lines of every single social issue of our day, they have to be equipped to fight those issues, from hunger to domestic violence to homelessness, just you name it, all of them. And then they have to teach our kids. So how did we get here? I think, for those of us here in this room, if you will, I think we've been thinking about this stuff for a while now. I think everybody's thinking about this stuff. That is a huge opportunity. It's also just so daunting, and I do think that technology, we've always we were heading in the direction of incorporating technology into the school systems and into classrooms, and now we're just exponentially asking innovators and tech to really look at this problem from a new angle and an accelerated angle, and really acknowledge the interconnectedness of the education crisis in this country, because it's not the education crisis. It's again, every crisis rolled into one. And so in a way, by just pressing the halt button, the COVID-19 crisis is allowing us, or forcing us, to go back and say, what happened if we could build it differently? How would we do that? And we have a lot of incredible minds working on that. And I think everyone acknowledges that we don't want to go back to where we were. When we say we want our kids to go back to school, we want our kids to go back to school. Well, we don't want them to go back to that. And I just am hopeful, eternally hopeful, that we keep this sense of desperation, even once we have a vaccine, even once we have, therapeutics that are super successful, because this is the kind of intensity that we need to keep moving forward with for years, in order to reconstruct something that was just, seems to have moved so quickly, intentionally or not, but in a way that is just simply not equitable.
I'll jump in there, because I think one of the things Allison said that, again, I don't know if it's I think silver lining's okay. The digital divide existed, right? We all know that because we're in the space. But I think COVID has put such a spotlight on it that I do think that more people are mobilized to try to fix the systemic problems than would have been. I think we were just sort of chugging along with the people in the trenches trying to solve the problem. And I think the shelter in place has made it so clear that other people are sort of rallying the charge. But in a very tactical way, I have to say I love this question, because I actually do think for our organization, it has given us so many different ways to look at things than we had that are making our product and our process better. So we have what we call a gradual release model, where we teach in a classroom 1 year, the next year the teacher teaches, our teacher watches, the next year that in-school teacher teaches on their own. Well, because of COVID, we've accelerated. We had two schools that wouldn't have gone independent for a couple of years. They're completely teaching on their own with our support, but they're teachers in classes. We have other teachers within schools. We used to have about, under 50% of our independent teachers getting to all the lessons. Now we're closer to 90%. And we're hearing from teachers that the kids are showing up for coding and art. So that's like pulling them in, and that's inspiring the teachers. So we're pushing forward on that model, which should allow us to get to a lot more schools faster. On our product, I mentioned the videos. We've also created hint systems. We're making all of these incremental changes to the product that make it better for remote learning, but will make it a better product in class. Teachers will have to carry a little less of the load with some of these product features we're adding that will make it a better product when we're in school. We had an on-site academy that we're not doing this year, but we used to bring kids in who were at schools that were on a bus route of a bus that we paid for. So there were kids across the counties. Compton we never got to because it was farther away from our building. Kids that were rock stars, that were inspired by coding, that loved coding, had a passion for it, that weren't doing after school work with us because we couldn't get them on site. But now there's a possibility that we can think about, how do you capture some of those kids that are sparked in an after school program that's virtual? I don't think we would have thought of that. There are other people stepping up. I know Microsoft has a Minecraft Education Edition, which they've created more mods, they've given them free to schools. So I think that public-private partnership that's going on. And when we talk about digital literacy, we've also had, one teacher told us that one of her special needs students, like she could see the confidence that he was getting because he was teaching his parents about coding and about computers. So that whole sort of family ecosystem where children are bringing it back to their parents who may or may not have that literacy yet, and they're inspiring that. And then the last story I'll tell is in our kindergartens, we don't start on computers, we start on paper or hand. And when one of our teachers told one of the kindergarten classes recently we were going to start working on computers, the little girl said, "I was so excited, I almost fell off my chair." And so that, again, that passion is being spread to the family because it's happening in the family. So I think there's lots of glimmers of hope and highlights of what we're all learning and doing more successfully during this period.
I would like to say that in the case of our organization, it kind of helped us to open our minds to new ways to do things, and utilizing, different platforms that we have been talking about, but even in our electronic medical record system. So we had already, prior to the COVID pandemic, we had already a transition from paper to electronic medical records, right? But we never actually identify maybe at that point the capabilities of the system or the potential that it had, and in terms of making our internal workflows even more efficient. So we adapted into new automation workflows into our EMR. We even are working on merging other medical records platform into our current EMR to facilitate the continuity of care from our patients. So I guess there are so many things and tools that we have available now that it's making our processes, our internal processes, more efficient and ensuring quality of care for our patients. So I guess that was something really important that we were even discussing that in our teams, about how now we were able to transition into this new modality. And we were we're now more used to it. And now we are exploring other features, for example, project management tools that are going to help us to collaborate virtually in our organization to continue working on the ongoing projects that we have, because as a nonprofit, you know that we work with so many grants and projects all the time. So and sometimes being away or doing remote work it doesn't feel the same. But when you have these other technologies on your systems in which you can work on, then it facilitates and the collaborative among the organization.
So wonderful to hear from all of you and how we've all, been able to make lemonade out of this. And I agree. I think silver linings is hard because we're still going through so much heavy, unfortunate realities, right? And I know there's still a long road ahead, and I'm sure a lot of us feel that. But one of our principles at Human IT, one of my favorites, is to change is to improve, to change often is to perfect. So just constantly staying curious, looking at change as an opportunity, and adapting as quickly as we can to new information we're getting. And this has really amplified that. And I think the beauty in that, what I really love is the community that's come of that. I think the last 6 months, we've had the opportunity to connect with so many different nonprofit groups, foundations, companies, all different folks from all different sectors that want to be a part of this together, and just innovating at a whole new level of creativity and speed at which we're implementing and seeing what works and then pivoting based on that. And it's that old saying, I hope I say it right, but if you want to go far, go alone. If you want to go fast, go alone. If you want to go far, go together. I think that's how it goes. So just that collaboration of getting to work with other folks to find, those long-term sustainable solutions, and collaborating with nonprofits. And I think that's something special about Human IT. We both work directly with the individual. A low-income family can come directly to us and get access to technology, internet connectivity, wonderful. We can also work with nonprofits to service, their community members or them. We've had nonprofit staff that say, we need devices to do our work, right? So getting to do both has been really special, and it's just highlighted the importance of collaboration and transparency with what we all really need to be successful and to get through this together.
Yeah, and I would say that it's driven us to have to experiment with a lot of different kinds of digital access that we would not have really looked at earlier. I think we wouldn't have been thinking about trying to reach people through Facebook Lives, even though people really, really like reaching us through Facebook Live. And at the same time, I think it's prompted people to try to reach us through digital access that they wouldn't have done before. And we've had pretty successful new member meetings with people who might not have come to a member meeting. I really would not have come to a member meeting over Zoom, So in that sense, I think it's kind of driven people to look at these digital tools in a new way. And some of the experiments work, and then some of them don't. Some of them we're still scratching our heads like, how come no one likes that, But we'll figure it out, and it's been a really good opportunity to do that.
Yeah, thank you all for sharing. I know it's been a difficult time, and we're all continuing to iterate and explore different solutions and adjust as needed. Even hosting today's webinar, it's not something we'd ever done before. So normally we would be with you all in person, but it's been a challenge for our team to coordinate, and we've learned a lot from it, which is, I think, all you can ask on some days. So we'll get started now with audience questions. We've reviewed the ones that have come in so far from the Q&A function. So if you have additional questions and you're with us live, please feel free to use that. But just to start us off, one of our audience members asked about the resources that are available to advance digital inclusion in our communities. Allie, I was wondering if you could share more about Human IT's resources and how the people joining us can access them.
Oh, I'd love to. Yeah. Thank you for the invitation. So, we're lucky in LA that there are so many resources available, and we have a state that's really so supportive of this work and what we need to do to bridge the digital divide and keep innovating. So, Human IT, as I mentioned, participants, any, household is welcome to reach out to us. We have text message and phone line. I'll add that in the chat as well, but if anyone would like to hear it verbally as well, our text line is 562-372-6925, and that can be any low-income folks across California, we can support them in getting access to either devices if they're looking for a computer, if they're looking for internet connectivity, digital literacy training, some combination. You know, they can text us there. Our phone number is 888-391-7249. And I'll put those in the chat as well. And to, you know, our community members that are maybe with a school district, a nonprofit group, a healthcare center, you know, please reach out to us as well. You can just email info@ or myself, it's my first name, Allie@humanit.org. And we'd love to support you as well in getting devices. We've been able to work with school districts to get thousands of devices in, you know, just a few weeks time span. And of course, the market for devices fluctuates. We get updates daily from, you know, bless my team that's on the front lines of keeping their pulse on that and what's even available, but really working our hardest to get devices out. And we do have low cost technology available on our online store. It's hitconnect.org, hitconnect.org. And I'll put all that in the chat as well.
Thank you, Allie. And we'll also send a lineup of different resources that we've collected, including Human IT's services, in a follow-up email after the event. Would anyone else like to share about that question? If not, I will move on with more audience Q&A. Okay, great. So someone asked, do you think that this energy and support for closing the digital divide will fade once the pandemic is under more control and restrictions are relaxed? And if so, how can we keep up this energy?
I mean, this is the kind of thing that organizations always, oh, sorry.
Go ahead, Cynthia, no problem.
I'll go ahead. The organizations always say, but I mean, it will fade if we don't keep it alive. And so I think it becomes incumbent on everybody who has concern about it to really keep that drumbeat going. Because you know, anytime we see, you know, powerful interests who probably don't have much of a vested, powerful, wealthy interests who don't have much of a vested interest in making sure that the digital divide is closed, because to a large extent, you know, people benefit from wealth inequities, want to keep wealth inequities there. So if you want to close them, and ultimately the digital divide, I think, has its source in wealth and inequality and white supremacy, the way most social problems do. You know, if you want to close that, it's going to take that constantly like raising up these problems over and over again, and a lot of really concerted organizing. And so I think it's important for all of us to not forget that this is something that we need to attend to, and that it is a social justice issue. You know, just the same way that a lot of other accesses to schools or you know, to any other kind of like major social institution is a really important social justice issue.
I also think there's a role for public-private partnerships moving forward, and I know that philanthropy is thinking this through, and there are partnerships being built that hopefully can, you know, in essence, endow that question, you know, so that it doesn't just die, or endow that goal, which is, you know, staying at this even though we're not in crisis. I think that philanthropy can step up and be the convener of conversations about that, and then also the catalyst for you know, support in terms of financial support in coalitions that continue to think about this as their main goal.
Great, thank you both. This next question actually is a great transition from what Allison just shared. But we got a question in the chat about partnership. So the question is, do you think that the pandemic has created more opportunities for organizations who were previously working on related issues, but often in silos, to collaborate?
I'd like to be optimistic and say yes. You know, I think technology is a great unifier. It's something that whether you're fighting for fair housing and access to housing or healthcare, education, we all need technology right now. So I think in some way it's a unifier for all of us to do the work that we know our communities need and are asking us for. So I've talked into a bigger variety of organizations than I've ever gotten to speak to in my nonprofit experience, and learned about so many issues, you know, across Los Angeles, and how people are affected in different ways, and how technology is a tool that's needed to further, you know, impact in a positive way and create that change. So perhaps I'm being a little too, you know, optimistic there, and I need that hope for myself, but I would say yes.
I think that I would say that also yes, and from the hacker perspective, I would say that at some point the lack of access to technology will also become part of the social determinants of health, if you think about it, because now little by little you need to healthcare and all the different services that you can get access to through now technology. And in the future, even if the pandemic is over, this is like a new way to deliver healthcare. And I know that it's for some folks, maybe they will say, well, I'm more like old school and provided in person, but you have to think also about that maybe that's very convenient in an urban setting, but also for rural settings. Sometimes they don't have enough specialty or enough providers there, you know, in the area. So when you think about it and that gap, you can bridge that gap with virtual visits or you know, technological platforms. So I will say that partnering with other organizations to ensure that the population gets a hold of more technology devices and platforms in general will be very, very important for the development of our community.
Thank you. Our next question is about how to kind of teach and instruct digital literacy. So we know a lot of nonprofits might have transitioned to a digital platform, but while they're working on providing that, they're also working on educating the populations they serve. So how have you done kind of digital literacy training in your work and in maybe conjunction with the other work that you already had as an organization? What are some models that people can adopt?
Sure, I'm happy to speak to Human IT's digital literacy platform. So we have a self-paced course that's online, and it's very entry-level computer basics. The first lesson is how to use a mouse. There's one that talks about software and how to open the internet browser and search safely in the search bar. So very high-level basics, but really the foundational basics that we all need to, you know, be able to engage with that technology safely. The course takes about 6 to 8 hours to complete. It's available English and Spanish, and it's free for folks across California right now. So what we're really working on right now is providing that specialized support so that we can answer questions as they arise. We have a chat feature and a text line, but we also know it can be a barrier to get on those things if you're learning how to use a mouse, right? So constantly innovating to making that as simple and user-friendly as possible. And we all know simple doesn't mean easy, right? So finding simple solutions that have a thoughtful intention behind them and long-term support. So we're really working with folks that way, and we have some documents that we can text people directly to show them the visual guide of how to turn on the computer, how to start the course, how to access it, how to set up an email, right? Things that we all take for granted. But I remember, you know, I'm not particularly tech savvy myself, and that feeling can be so overwhelming when you're logging on a platform for the first time. So having those screenshot images to walk folks through it, we found to be helpful.
I just wanted to add, I also find Common Sense Media to be a wonderful resource for parents, teachers, and the general public, even kids, in terms of many aspects, from digital literacy being one of them. But I know that I often, you know, I turn to Common Sense very often, so I would recommend it.
Thanks, Allison. For our last question, Dr. Juarez, I was wondering if you would share a little bit about your Promotora model and how you've used them and even trained them how to train people on the technology.
Sure. So the organization has been working for several years with these community health workers. These are recognized leaders that they were patients, and then they wanted to get involved into community outreach events and helping as leaders in their communities to socialize and educate our patients into different topics for healthcare. So now with the opportunity to deliver care through these virtual platforms, the Promotora model it's being also identified to support into this program, into bringing new information to the patients that are struggling the most, into accessing the devices and to navigating on the portals, right? And how to connect to Wi-Fi, how to log into my clinic portal or send a text message to my provider, etc. So we are partnering with another organization that is providing us with the devices, and the promotoras and the community outreach department are working together, delivering these devices and hotspots for the patients that are in need. So the way that we've been doing it right now during the pandemic is workshops and activities. So sometimes even at the clinic, when we ask the patient, oh, can you please provide me your email address so we can communicate with you? Sometimes they say, oh, I don't have an email. And then we ask, well, but do you have Facebook? And they say, yes. Well, in order to have Facebook, you have to have an email, right? So I guess my point is that everybody's on Facebook lately, or in these other social media platforms. So this is the way that they are engaging the community. And sometimes they can get support from their children or another family member that are helping them to log in and attend the event. But also we do several activities in the community. We're doing also COVID testing with different organizations. So we do outreach and education during those activities as well. So we provide the PPE for the promotora so they can spread the word and provide some educational materials to the community. But we are one of the few organizations, I would say, that are still doing all the community outreach events through Zoom and through Facebook, and engaging the community into healthy habits. For example, doing Zumba or nutritional workshops via Zoom or via Facebook. So we keep our community engaged, especially because they are in contact with leaders from the community.
Thank you so much. And with that, we are at the end of our time today. Please join me in giving a round of applause from across Los Angeles and beyond to all of our panelists. Thank you so much for joining us today. And thank you so much to our attendees. We know Zoom fatigue is real, so thanks for sacrificing some of your screen hours to learn from our wonderful panelists. We'll be sending out a resource guide with just some of the tips and tricks they shared about meeting community members where they're at on platforms like Facebook Live, accessing resources like Common Sense or Human IT. And we hope to be a part of continuing this conversation in our region and beyond. So thank you so much, everyone. And if you have any questions, you can always follow up with us at connect@LA2050.org.